So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome. Thank you so much for joining today's student call. We will be covering the opioid epidemic, navigating through crisis and hope. Today, we'd like to thank our student speakers, Karizza Cordero, Crystal Rylowicz, Zuha Mehdi, myself, Cynthia, Blanca Morales. We'd also love to thank our slide contributors, Crystal Rylowicz, Raven Moore, Bishara Sheikh, Karizza Cordero, and Kadeza Ahmed. Thank you, Restream, for supporting our student team. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. Our message of public health and wellness now reaches those who need it the most. Today, we would like to feature our very special advisory board member and celebrity feature, Ken Seeley. He has a rich background, as you can see on the screen, and I'm going to go ahead and feature him so he can go ahead and introduce himself. And Ken, have at it.
Hey, how you doing? Thank you for having me today.
Thank you for being with us, Ken. We are so grateful.
Oh, absolutely. It's an honor and a pleasure. And yeah, just a little bit about me. I started, doing interventions in about 20 years ago. And before I did interventions, I was doing like a lot of different marketing jobs and things like that. That wasn't really in my passion. And when I started thinking about how do I help people? How do I help people get out of misery? How do I help people that are suffering? And there was a huge need for people that were out there using, and family members that were devastated because they didn't know how to help them. I started doing interventions. And then the interventions got so busy, and then there was a TV show called Intervention on A&E that I was able to participate in. And, this week, Monday, we start a new season. So we're very excited about that. And then in that process, we opened up Sober Livings. We have a drug and alcohol treatment facility in Palm Springs, California. We have a mental health facility that we're just remodeling right now and putting together that'll be opening up soon in Palm Springs, California. And then we do education. We help people to get their drug and alcohol counseling degrees, certificates. So we've been busy. We're very excited. We love working in this field because what is the number? Like 25, 30 million people out there in this country alone suffering from an addiction that need help. And then if you times that by 2 or 3, that's how many family members and loved ones are watching them die. So I'm glad to hear your presentation and to be here and do anything I can to help today. So thank you.
Thank you so much, Ken. That was a very meaningful introduction. And I'm just going to go ahead and highlight your background here. It says you're a certified intervention professional and certified case manager interventionist. You're a founder of Intervention 911 and Ken Seeley Communities. We shared the link, both the links to the intervention show and your communities on the screen. You're the author of Face It and Fix It. You have notable appearances on A&E's Intervention. You conduct trainings for interventionists globally, and you've trained over 450 individuals in the USA, collaborating with the Joint Commission for National Standards in Case Management and Interventions. Thank you for all you do, Ken, and for being here today. So going into the agenda, and then I'm going to hand it over to our next student speaker, Crystal. We will be covering introduction and overview, types, health impacts, background, factors, and statistics, consequences of overuse, economic impact, and impacts on families and the community, prevention and intervention strategies, roles of healthcare professionals, community engagement and support, our conclusion, and then a student discussion where we will be featuring Ken back on the screen with the students, and we'll recap our conversation and address the questions.
Introduction. The alarming rise in opioid-related deaths is a concerning trend, with each year showing an increase. Opioids used for pain relief are highly addictive, leading many to turn to street drugs like heroin or illicit fentanyl. Prescription opioids intended for pain management often result in misuse and addiction. These addictions cause widespread physical harm to families and communities across the nation. Opioid types. Prescribed pain medicine examples include oxycodone, oxymorphone, hydrocodone, hydromorphone, fentanyl, morphine, codeine, methadone, tramadol, bupropion. Illegal drugs include heroin, which is an illicit opioid derived from morphine, highly addictive and dangerous. Synthetic fentanyl is a synthetic opioid, such as fentanyl and methadone, that mimic natural opioids in the brain, providing pain relief such as morphine and codeine. Impacts on physical and mental health. Physical impacts include digestive problems, circulatory issues, immune system issues, nausea and vomiting, restlessness, violent tendencies. Mental health includes post-traumatic stress disorder, insomnia, depression, delusions, anxiety, and trauma. Background and context. Before the 1900s, the United States began struggling with the abuse of opioids before the 1900s. Wave 1, 1999. The number of overdose deaths involving prescription opioids, natural and semi-synthetic, and methadone started to increase. Wave 2, 2010. Heroin overdose deaths began to increase. Wave 3, 2013. Illicit fentanyl significantly increased overdose deaths. Currently in 2023, the number of opioid overdose deaths continues to increase. Factors. The opioid crisis stems from various life challenges. Examples include pain from injury. Chronic pain drives people to opioids, potentially leading to addiction. 2. Peer pressure. Influence from friends prompts experimentation with opioids. 3. Job loss. Financial strain and stress push individuals to opioids for solace. 4. Previous addiction. Past struggles increase susceptibility to opioid dependence. And 5. Boredom. The lack of purpose drives opioid use for entertainment. Recognizing these factors is vital for combating the epidemic and deploying effective preventive measures.
Comparison and statistics. The bar graph on the left reveals that from 1999 to 2021, the number of overdose deaths from opioids has increased. Sadly, the numbers continue to rise. The graph also shows and reveals that more males are dying compared to females in this epidemic. The epidemic of opioid addiction and its consequences touch every community, every demographic, and every single one of us in some way. Stated by Michael B. Hancock, former mayor of Denver, Colorado. The health consequences of opioid overuse. Short-term effects consist of pain relief, euphoria, respiratory depression, drowsiness, nausea and vomiting, constipation, confusion and cognitive impairment, dizziness and lightheadedness, itching and flushing, decreased heart rate and blood pressure, along with tolerance and physical dependence, and obviously overdose. Continued now discussing the long-term effects consist of hormonal imbalances, physical dependence and tolerance, social and economic consequences, chronic pain and opioid use disorder, increased risk of coronary heart disease, respiratory complications and cognitive impairment, and risk factors for heart rhythm abnormalities like atrial fibrillation, GI issues, which can lead to fatal complications, along with cardiac events including stroke, heart failure, and death, which are more prevalent in opioid overdose cases compared to non-overdose cases.
Here we have the economic impact of the opioid epidemic. According to the Department of Health and Human Services, we see that about $55 billion a year are spent in health and social costs related to prescription opioid abuse, and around $20 billion a year are spent in emergency department and inpatient care for opioid poisonings. According to the Centers for Disease Control and Prevention in 2023, the economic impact worsened post-pandemic, and the healthcare sector is affected by frequent hospital visits due to opioid addiction. And there was a rise in criminal activities. So drug-related offenses increased costs to the criminal justice system. Increase in opioid overdose deaths impacting family and communities. The impact on families and communities include the breakdown of families. So we see parental neglect and instability. We see emotional distress. We leave children very vulnerable with mental, behavioral, and physical health issues. The parental substance use disorders altered the mood, fixated on getting high or recuperating. We also see unstable guardianship that affects healthy connections, and relationship instability with caregiver leads to child issues such as anxiety, sadness, and failure to thrive. And let's not forget the financial hardship, with over $78.5 billion spent annually in the United States on prescription opioids. Here we see a continuation of the impact on families and communities. The impact of opioid addiction is not just felt by the abuser, but also by family, friends, and their community. The stigma and isolation pose barriers to accessing services in remote regions, exacerbating the scarcity of job opportunities in rural areas. Studies have revealed a troubling trend. Opioid-related deaths in these regions tripled for females and quadrupled for ages 18 to 25 from 1999 to 2015. Community disruption manifests as increased crime rates, strained social services, and decreased economic productivity. The, the profound loss and grief are evident, with over 100,000 Americans succumbing to opioid addiction since 2015. Additionally, the alarming prevalence of neonatal abstinence syndrome affected 21,732 newborns in 2012, highlighting the pervasive impact of opioid misuse on society. These are some of the prevention and intervention strategies that we are doing, or that we see the many organizations doing. Prescription guidelines and monitoring programs to ensure safe and appropriate use of these medications while minimizing the risk of misuse, addiction, and adverse outcomes. Some of the initiatives include guidelines for prescribing, screening and assessment, informed consent, prescription drug monitoring program, prescription limits and refills, monitoring and follow-up, education and training, and interdisciplinary collaboration. Accessible healthcare and treatment options. Addressing the opioid epidemic requires a comprehensive approach that includes accessible healthcare and treatment options. Some examples include medication-assisted treatment, opioid treatment programs, prescription drug monitoring programs, state prescription drug laws, quality improvement programs, primary care integration, community-based programs, recovery support services, public health initiatives such as outreach and education campaigns, and school-based prevention programs. And we understand that support for individuals in recovery is an essential for maintaining sobriety, rebuilding lives, and preventing relapse. Some support services and resources include peer support programs, sober living homes, recovery coaching, counseling and therapy, employment assistance programs, vocational training programs, legal assistance services, health and wellness activities, community-based support services, and online support communities.
Continuation of prevention and intervention strategies, law enforcement efforts, and legal consequences for drug trafficking. These are essential components of a comprehensive approach to addressing the opioid epidemic and reducing the supply of illicit opioids in communities. Examples: investigative task forces, undercover operations, interception efforts, asset forfeiture, prosecution and sentencing, federal drug trafficking laws, state drug trafficking laws, international cooperation, community outreach, and education. Role of healthcare professionals. Healthcare professionals educate patients on pain management, recognize signs of opioid abuse, and provide support for addiction treatment, aiding prevention efforts. Registered nurses, highlighted by the American Nurse Association in 2018, educate patients on pain treatment options, including opioids, and identify those vulnerable to substance use disorder. Together, their efforts are integral in addressing the opioid epidemic and promoting safer pain management and practices for individuals at risk of substance misuse. Signs of opioid abuse include loss of control, requests for increase in opioid prescription medications, decrease in activity. Withdrawal symptoms include anxiety, reduced motivation, hallucinations, and depression. Community engagement and support play a vital role and are often at the forefront of epidemic, serving as a vital treatment hubs for individuals grappling with opioid use disorders. Things the members of the community can do to aid in stopping of opioid abuse include use of poison control for medication interactions, learning the signs and symptoms, listening to their loved ones, attending support groups. In conclusion, the alarming surge in opioid-related fatalities unveils the grim reality of addiction's pervasive grip on our society, necessitating an immediate and comprehensive public health response to combat this opioid epidemic. Despite the opioids' intended purpose for pain management, their addictive nature has enraged many, leading to the dangerous dependencies and resorting to street substitutes. The widespread misuse of prescription opioids has inflicted immense suffering on individuals, families, and communities nationwide. An urgent action is imperative, emphasizing prevention, education, and harm reduction strategies. Through collaborative efforts, we can envision a future where the devastating impact of opioid addiction is curbed and all the affected individuals receive the support they need to heal and flourish.
Thank you, Crystal, Karizza, Blanca, Zuha. Amazing. And the slides look amazing and such informative information. Now we're going to dive into the questions and we're going to put all of us on the screen and start discussing these questions. So the first one is what factors contributed to the rise of the opioid epidemic? The opioid epidemic can be attributed to a combination of factors, including overprescription of opioid painkillers by healthcare providers, aggressive marketing tactics by pharmaceutical companies, lack of regulation, and insufficient awareness about the addictive nature of opioids among patients and healthcare professionals. The second question on this slide that we will also discuss: how has the opioid epidemic impacted communities across the United States? The opioid epidemic has had devastating effects on communities nationwide, leading to a significant increase in opioid related deaths, strain on healthcare systems, and economic burdens. Additionally, there has been a rise in cases of opioid addiction, resulting in broken families, increased crime rates, and social stigma surrounding addiction. So, we will go ahead and have everybody on screen. And Ken, what are your thoughts?
Yeah, I mean, I great presentation, by the way. I love what you put together. You know, when you've seen the chart of from 1999 to 2021 and the graph that just keeps going higher and higher, it's just devastating. Regarding the first question, there are a lot of regulations that they put into place to kind of slow it down. But I know a friend of mine just came to visit me in Hawaii, and he got here yesterday, and he was telling me about a doctor in LA that is prescribed oxycodone to a 20-year-old, the mother, the father, and the caregiver. All four of them got a prescription of oxycodone because the mother is addicted to them. So even though there are things put into place, we're seeing the graph continue to grow. The deaths are continuing to grow. So I think we got to really tighten it up a little bit more. I think we got to be a little bit more aggressive in our approach, because the deaths keep growing, and that's the evidence of where we're going. We have the evidence right in front of us with that graph, and we need to do something about that. And what was the second question? I'm sorry.
Oh yeah, no worries. So how has the opioid epidemic impacted communities across the United States? You've touched a lot on that as well.
Oh my God, right? I mean, that's where I get contacted a lot, is the family members. I just got a message on social media, like, please come help our community. The drugs, everybody's walking around like zombies with the fentanyl because they can't get the opiates anymore. So they go to the fentanyl, and that becomes the drug of choice. But like I said in the introduction, a lot of, every single person that's addicted out there to these drugs, they have one or two family members that are also affected, and their lives are devastated, because when you're taking the drugs and you're under the influence, you're numb to reality. But the family members aren't numb to that reality. They're feeling the pain. they're right in the trenches of the disease. And it's just heartbreaking. I've seen parents get divorced over how to deal with their child's care and what to do around their addiction. And they end up getting separated. So it's not only tearing apart and taking the lives of hundreds of thousands of people every year, but it's ripping the hearts out of the people that love them. And then the crime, you talked about the crime. That was really good. You know, I noticed that, you know, people that are, you know, now that the graph of people dying, the crimes are going up. So it's just a lose-lose situation. And we just have to do more. We have to do more. We're not doing enough. We're not getting out there and helping save these people. I mean, I think still the number is what, 300 people a day dying, just in this country alone. So we're not getting out there and doing what is going to be necessary to really fight this battle at so many different levels.
Thank you so much, Ken, for providing that insightful feedback and the truth of what we're dealing with in this nation. Crystal, what would you like to add, my dear?
Yes, hi. What is really sad is my mother and I were in several car accidents, and we both needed to be put on pain medicine. And we were put on 5 milligrams of hydrocodone. And I had neck surgery. And so, you know, I was prescribed to take 5 milligrams of hydrocodone every 4 hours, in which I didn't because it made me feel worse than, you know, being in pain. I almost would rather suffer in the pain. But at the same time, my mother was put on a little bit higher of a dosage. And she was going to a doctor in Williamsville, New York, who was actually busted by the FDA for giving pills out like they were candy to patients that he didn't even see. And so he is currently, I believe, still serving jail time. I don't remember the exact year he was convicted. I'm pretty sure it was like 2013 or thereafter. But it's just so ridiculous that you go through all the medical training, you understand what these drugs do, and yet you're still going to prescribe them to people that you don't even see, that don't even have a problem medically. And you're okay with that because you're a doctor and you can get away with it for so long until it catches up with you. And then you still don't know what to do. And the worst part of it is these doctors that are doing it don't even care even when they get caught. And it is wrecking so many precious lives, whether we realize it or not. And it really does need to come to a complete stop before we wipe out the whole earth, when this could be prevented.
Thank you so much, Crystal, for that insightful awareness piece and sharing your personal story. Karizza, my dear, what do you think?
Yeah, I agree with the bar chart. It is alarming seeing those rates rise, especially after the pandemic. So a lot of things were shut down, right? So that means a lot of deaths occurred also too. And then after the whole closure, pretty much people can't get help, access to services, etc. So harm reduction strategies couldn't take place. So hence the rise, along with after post the pandemic, a lot of children you would see a lot on the news. It was really alarming because my parents would bring it up. They'll be like, "Did you see those 2 young girls who just wanted to party because everyone has been locked down, closed at home, stay safe?" And then people just started taking all these drugs and they thought they can have all this fun. So it leads to misuse, and then also adding and contributing to this opioid pandemic, which is really sad.
Thank you for sharing that. Blanca.
So I have been working in healthcare for about 10 years now. And I remember that when I first began working in healthcare, I was at a physical therapy office for people and patients that were involved in car accidents or really bad falls. Um, and it was really alarming to see that some of the patients, at least in this clinic, the doctors were very good about prescription drugs, and so they didn't give any pain medicine that was over 800 milligrams of ibuprofen or Tylenol. And instead, what they did is that they would refer to a pain management specialist that can give um, higher doses of different type of pain medicine to the patients that had chronic pain. But I remember an instance where there was a patient that had been coming for years um, to get his therapy after an accident, and he was very mad and frustrated that the doctor wasn't giving him oxy. And the doctor was basically like, hey, like, if you need something, you need to go to a pain management specialist. They would be able to assess what kind of pain medication you need. But he got very, very aggressive, and so they were about to call the cops on him because he just didn't want to hear that. He wanted oxy. He said that that was the only thing that would work for him. But if the doctor wasn't giving it to him, where was he getting it from? So that was the question. So that was like a good side of healthcare where I saw that the doctors were really careful about the type of medications that they were prescribing to their patients. But then as I moved on in healthcare, I came to a private hospital, and I realized that in private hospitals, patients have a little bit more power about what kind of medications they get because they are more persistent. And some doctors, not all, some doctors are willing to kind of like listen to what the patient is asking for and give them pain medication that really they don't need more than or something over the counter. So it was eye opening to see how that happens within healthcare.
Thank you so much for sharing that. Zuha, what are your thoughts, my dear?
I would say that opioid epidemic didn't start suddenly, and it wasn't caused only by a single thing. It was a combination of powerful drugs that were readily available, and illegal drugs taking the place, and limited treatment options, and social factors making the people and the communities being more vulnerable and relying and getting addicted to opioids. And it was in 1990s, as we see on the bar graph, that there was a shift on how the pain was perceived in the early years and how it was managed in medicine. And opioids did come out, but it was in the early 2000s, I believe, that people were getting aware of how opioid drugs affect, and people are getting addicted to it. It's having bad consequences on health. And then it was like restrictions came over opioids, and the pharmaceutical companies aggressively marketed these opioid painkillers, and hence the risk of addiction just goes on increasing. The doctors were also influenced by this, few doctors, and then there was marketing efforts and new pain management guidelines came into action, and prescribing opioids became more readily available even for chronic pain conditions, where after surgeries it is given, but relying only on those medications led to dependence for these opioid drugs.
Thank you so much for sharing that. We will go ahead and dive into the second set of questions, question 3 and 4. What are some strategies that have been proposed or implemented to address the opioid epidemic? Various strategies have been proposed to tackle the opioid epidemic, including improving access to addiction treatment and recovery services, implementing prescription drug monitoring programs, increasing education and awareness about opioid misuse, enhancing regulation of opioid prescribing practices, and expanding access to naloxone, a medication used to reverse opioid overdoses. The fourth question: how can individuals and communities help prevent opioid misuse and overdose? Individuals and communities can play a crucial role in preventing opioid misuse and overdose by educating themselves about the risks associated with opioids, properly disposing of unused prescription medications, advocating for policy changes to address opioid epidemic, supporting individuals struggling with addiction, and promoting alternatives to opioid pain management such as physical therapy and non-opioid medications. So I will go ahead and put us all back on the screen here. Ken, what would you say? What is your input on all of this?
Yeah, I think the strategies, are, that you talked about are spot on, really having more access to treatment. And I think they're doing a really good job right now with that. I know a lot of state funded facilities are opening up where people that don't have the means are still able to get treatment. I know a lot of nonprofit facilities are doing really well on getting the message out there, and they're getting grants and funding to be able to treat people. So I think that's really been helpful. Education is really important. I think the one thing that they're missing though is getting more interventionists out there on the education part, where when you see the warning signs. I think that's one line that we need to work a little harder on, is because when people go from abuse to addiction, what is that line? We need to educate families on what that line is, and then the importance of intervention, and that intervention is not intrusive, intervention is not punitive. It's the most loving thing that you could do for a loved one suffering with an addiction. So I think that's one of the other strategies I'd like to see moving forward, is the front ends being able to intervene sooner and educating families from the process from abuse to addiction. Regarding community health, I think community health is really getting out there. I think a lot of people are doing some really great work out there in their communities. But what I also would like to see is, understanding, because I still hear this. I'm like so surprised that I hear this in different communities, that it's a moral decision. It's a choice that they're making. They deserve to die because they chose to do the drugs. So really getting a little bit more information in our communities that, well, I mean, every community has it right now. I don't care where you live. I live in Hawaii right now, and we have it. The homeless population, with the mental health and addiction issues that we're going through, I'd like to see more compassion from the communities, that this is not a choice. I don't know one little kid that, you ask, at 10, 11, 12, even 15-year-olds, what do you want to be when you grow up? I don't know one that says, I want to live in that tent and, be homeless. That's not their dreams. It's not a choice. It's because of the traumas, the things that you guys talked about at the beginning on the slides. It's the trauma. It's the different things that happen. The lack of purpose. That was a perfect one that you talked about. These people lose their passion and they don't realize what their purpose is. So I'd like to see communities getting a little bit more involved in that part.
Thank you so much for sharing that. I couldn't agree more. Zuha, would you like to add anything to the discussion, my dear?
Yeah, sure. I would like to share something. I happened to meet a friend here in Texas, where she said she and her friend, they were like three people. After a party, they lost the life of one of their friend in their arms because he did an opioid overdose. And my friend, being from the healthcare background, she cried for help, and she was crying because she knows about naloxone. Naloxone is a medication that can quickly reverse an overdose from prescribed painkillers or any form of opioid medication. So she was like, only if we had naloxone readily available, we could have saved his like their friends' lives. I think equipping our communities, making naloxone medication readily available at pharmacies that can reverse opioid overdose would be very beneficial, because it does not affect someone who does not have opioids in their system, but it's not as a treatment for opioid use disorder, it's for opioid overdose. And it is effective with both prescribed painkillers, oxycodone, hydrocodone, and heroin and fentanyl too, and addressing some social issues like poverty, unemployment, and mental health. With this, can also prevent people from turning into opioid overdose in the first place.
Thank you so much for sharing that, Blanca.
I actually wanted to add to what Zuha was saying about having access to naloxone, also known as Narcan. So actually, here in New York, you can sign up for a training with the Department of Health, where you take a small training. You can do it via WebEx or other video formats. And after you are done with their training, they send you a little kit that has 2 pumps of Narcan, so that you can be a first responder if you are ever in a case where you need it. So you carry that with your purse or in your book bag. And it was actually really nice. I took that training about a year and a half ago. And just to know that there are people outside on the street, or at a party, that may be carrying Narcan as a first responder, I think that's a really good program. And I don't know if other states are doing it, but here in New York City, you can sign up for it, and they will give you, like I said, 2 pumps of Narcan, so that you can be a first responder if you're ever in a situation where someone has committed an overdose.
Wow, I did not know that. Thank you so much for sharing. Karizza.
To piggyback off of the ladies here in California, I know there's like vending machines. So it's on locations like they'll put it like in downtown LA, so near clubs. So if people are going to be doing stuff like that, they can make it aware. They're trying to do better public health messaging when it comes to this through other ways that can be effective on targeting the audience. I know for sure community-based organizations. I can see in our hospitals there'll be flyers posted up. Even the healthcare providers will even advise it when they prescribe, say, like a medication along with the naloxone or Narcan. And then they'll tell them, like, you should look into these resources and everything like that. But it's kind of like a little bit. And then, like what Ken was saying, it would be really nice to not only educate like just the patient, but the family and friends, because they are the ones that can make a difference and empower and even save the lives of those who are affected. And I just think, once again, like support and harm reduction. So those like little interventions, those locations where they teach you how to use these Narcans and naloxones whenever there's an opioid misuse or somebody's going through it, it can be very impactful for the community and society as a whole.
Thank you so much. That's a powerful message. Thank you. Crystal, my dear, what would you like to say?
Yes. Here in Tennessee, the providers are actually running out prescriptions for their patients. I know several people who have gotten prescriptions for the naloxone, and thankfully we haven't had to use it, but at least it's there should we be out on the road somewhere and we witness an emergency. Secondly, I would like to really piggyback off from what Ken was saying, and we are not as empathetic and sympathetic within the community as we should be. It is the same thing. Nobody asks for mental health issues. Nobody asks to be born needing chemotherapy as a young child. And so we should be very much less judgmental, because we don't know what a person goes through until we walk in their shoes. Now, is the correct message to go out and get fentanyl and get hooked on the drugs? Absolutely not. We need more education, but we need to be less judgmental and love each other and help each other get through the struggles. And if I had one wish, that would be it, to see us all come together to prevent such a horrible tragedy from taking what is left of humanity in this world.
Thank you so much. That was very meaningful to say, and I couldn't agree more. And I actually met Ken. I reached out to him around 2014, 15. I was heavily addicted to prescriptions, and I went to 4 different treatment centers in Malibu, Colorado, Utah, Georgia. I was not getting it together. And at the end of the day, I figured out that I had trauma. I went through a lot of sexual, mental, physical abuse as a child. I was born with a physical deformity. I just recently had surgery. So sometimes I still, when I get surgery, I do have to take medications. But now I have a strong mindset where I've learned that my traumas don't define me. And it's hard to get through that. A lot of these people that are suffering with addiction, such as I was, they don't have the support. They have enablers. You see that constantly on the intervention show. And that's why I think such a heavy emphasis on the intervention show is going to a treatment center away from where you live, away from your enablers, and then you see these people rehabilitate where they went to treatment. They actually end up moving there. And, we just saw Crystal. I went to school with her, a different Crystal in Big Bear Lake. That's where I grew up, Ken. And I just saw that show and I went to school with her. And she was on the show and had alcoholism and, lost her boyfriend to a fentanyl overdose. And it was just traumatic. And, the fact that she was able to renew her life and uproot and go to Sacramento, I'm so proud of her. And yeah, so Ken, I would love to close out the show with any final remarks, any important messaging, and thank you so, so much for being here today. Oh, we can't hear you. You're on mute.
Sorry about that. I said thank you for having me. It's really an honor. I love what you guys are doing and bringing the awareness and getting the message out there. But I think one of the most important parts is because when you see people get into recovery, like you said, you've been trying since 2014 and 15, right? But I think, having more compassion, because the people that get into recovery end up being the leaders. They end up being the strong people in our communities fighting back against this addiction and mental health crisis that we have going on. So instead of looking at them as, the weak ones, the people that are out there, that they make a choice, like we talked about, that's not a choice, but looking at them as they could be the leaders. They could be the people that are fighting harder than anyone else in our communities if we give them the opportunity. And that's the key. We got to give hope to these people. Thank God people had hope for me, because in July I'll have 35 years sober. And if they didn't have hope for me, I wouldn't be here today. I would have never lived this long. So we got to give that hope to these people that are out there suffering, so they could get into their purpose and start enjoying life instead of existing in life. So thank you so much for having me.
Thank you so much. And all of the students that have contributed, we are so grateful for you being on the call today and providing your input and your personal experiences. We will see you next time, and thank you